Laura Wallace is a 46-year-old law enforcement officer with an active lifestyle. 4 years ago, she was the victim of a vicious assault, which left her deeply depressed. Recently, on the road to recovery, she decided to have plastic surgery.
I felt this would be a good time for some changes in my life, including a reduction that I had wanted for years.
During her procedure, Laura began having an irregular heartbeat. The surgeon stopped the operation.
She's had some extra heartbeats, so I think what we're going to do is not do the face today.
3 weeks later, Laura returns to the surgery center.
Ready to go?
Good. Yeah, have a seat, Dr. Moelleken. I'll be right with you.
Hey, thank you.
Her cardiologist has given her a clean bill of health. She is ready to continue with a facelift and neck tightening. Dr. Moelleken prepares to complete Laura's facial surgeries.
I'd like to fill this area in here, the little live fill.
Here we go.
As Laura is prepared for anesthesia, Dr. Moelleken scrubs for surgery. He starts the facial procedures by liposculpting Laura's neck area.
It's encouraging that we're getting so much fat out, because the more fat we get, the cleaner the neck becomes.
He then tightens the platysma muscles in Laura's neck to give her a more defined jawline.
We're going to try very, very hard today to get that 90-degree angle. So we're lacing up the neck.
The surgery continues with the mid-facelift.
We're going to go behind this little bump called the tragus, and then we'll go underneath the earlobe. Are you happy with that pressure?
The anesthesiologist is monitoring Laura closely. So far, everything is normal. After putting the final stitches on the left side of Laura's face, he begins on the other side. Tissue harvested from the abdomen, called live fill, is ready for the next procedure.
Well, let's make our little incision here in the corner of the mouth.
Dr. Moelleken implants these living fat cells into the creases of Laura's face. This technique will add volume to the area between her nose and lips.
These little strips of tissue are all alive. This is very different from fat injection, where they're not alive.
Now he inserts the live fill into Laura's lips to give them a fuller look.
People get collagen in their lips to fill it up, and this is permanent collagen. And this operation actually cannot be done on someone who's smoking cigarettes, because the cigarette smoke would kill the graft.
With the live fill procedure complete, the second half of Laura's surgery is over.
She didn't have a single extra heartbeat this time. So that's medicine for you. There's a lot of unpredictability. All right. Well, you can just go back to sleep, okay? Medicine will go away on its own, but everything went perfect.
Thank you.
Laura Wallace is one step closer to being comfortable with her body.